Welcome to Vegas Circle Podcast with your hosts, Paki and Chris. We are people who are passionate about business, success, and culture, and this is our platform to showcase the people in our city who make it happen. On today's podcast, we're going to be sitting down with dermatologist and Mohs surgeon. We'll discuss some of the practical ways that you can better protect your skin, especially in this extreme Vegas heat. Let's welcome to the circle Dr. Brittany Buhalog. I say it the right way?
Yes, thank you for having
Chris was
me
killing
on.
me before we started.
You did
Got it right. So it is very good to meet you finally in person. We'd love to have you to come on just to kind of give us some breakdown and we can kind of learn from you a little bit. But
Definitely.
Dermatologist is your background. What made you choose that kind of line of work and care to get into?
Great question. When I was in medical school, I liked everything that I did, and I couldn't really pick a specialty that I loved. But I did really like operating, and I really liked surgery. And in dermatology, I felt like you were kind of the generalist of specialists.
Mm-hmm. Okay.
You do medical dermatology, surgical dermatology, cosmetic procedures. And throughout my residency, I just learned that I liked skin cancer and operating the most. So I spend about 90% of my day doing skin cancer surgery, specifically Mohs micrographic surgery. And then I spend about 10% of my day doing cosmetic procedures, minimally invasive things like injectables, lasers, things like that.
Wow. Do you have like the flexibility to do multiple avenues? Like when you come to dermatology degree and we say like cosmetic surgery, what does that really entail? Is that like full reconstruction? Do you have the ability to do that, or do you just choose what you want to do?
Yeah, so not every dermatologist is going to do the same type of reconstructive surgery that I do. So I did an additional fellowship. So I'm board certified in dermatology and then also board certified in Mohs micrographic surgery, which is the skin cancer removal as well as the facial reconstruction afterwards. So I'm not a facial plastic surgeon. I'm not doing nose jobs, brow lifts, blepharoplasties. I'm doing purely cancer removal and then reconstruction. So if you get a cancer on your nose and I have to cut off, half your nose, I'm also going to put it back together for you afterwards.
Wow. Yeah. How do you put it back together? Like, what is the process of
very
of
carefully.
that?
Great question.
Jeez, yeah.
It really depends. I mean, sometimes you can just stitch the sides of the skin together in just a straight line. That's very easy. That's called a linear repair. But then sometimes you have to get really creative. And so if I am removing, part of an entire nostril or, part of a nose, then sometimes I have to take skin from the cheek and put it onto the nose, or the forehead and put it onto the nose. Sometimes I have to take cartilage from the ear and also put it in to add more support and structure. So it really gets, I think there's a really good mix of science and art when it comes to Mohs surgery, which is one of the reasons why I love it. I liked everything. So being able to really mix the two has been just a really fun career so far.
You must really impact a lot of people's lives, man, especially when you're dealing with your face, to be this. That's a challenge. That's a huge challenge. Yeah.
I think it's really anxiety provoking for a lot of patients to come in. First of all, they've got the C word. They've got a skin cancer. They're really nervous about it. They're really anxious about it. I walk in, I look like I'm 12, they're like, are you old enough to be doing this?
That's funny. Yeah.
And then, everything that I do is under local anesthesia, meaning patients aren't asleep when I'm operating on them. So, we get to chat. I get to know them pretty well, get to know about their grandkids really well. But it's a lot of anxiety for patients, and it's really rewarding to be able to get them through that experience and have them feel like, oh, that wasn't quite as bad as I was anticipating.
For sure, yeah. What are some of the kind of, how do you get cancer surgery? I know there's a lot in depth, but what's some kind of like the average things that people are getting, on a regular basis that you have to treat? Because I know it's got to be similar, a lot of similarities. Yeah.
So the most common type of skin cancer is basal cell carcinoma, and that is made up from one very specific type of cell in the top layer of your skin.
Okay.
That is almost always entirely caused by ultraviolet radiation from the sun. So the more sun exposure you have, the more burns that you have, that puts you at a higher risk of developing that type of skin cancer.
Okay.
Squamous cell carcinoma is another very common type of skin cancer that I treat, and that is a lot of that has to do with the sun as well, mainly ultraviolet radiation. But squamous cell carcinoma can also be caused by a variety of other factors, even like the HPV virus. It can be caused from immunosuppressive medications, but a lot of that is caused by the sun.
Okay.
Melanoma is another one that I operate on commonly, and that is also very frequently driven by ultraviolet radiation exposure, but melanoma can have some other genetic causes or genetic contributions to its development. So that one's a little bit more multifactorial, but by and large, it is definitely caused by the sun.
Yeah,
Yes.
and you're kind of seeing dermatologists, when I always think about them, is like going to somebody for preventative maintenance, right?
Yeah.
Essentially, but you're seeing it become more and more of a reactionary type of, when people are saying now you need to go see a dermatologist because you're past this threshold.
Right.
Is there part of your practice? I know, because obviously you're more of a surgeon and doing more of that surgery type spot, but do you really spend a lot of time on how to prevent these things from happening? And like, what are some thoughts on somebody who may not be as mindful of what they're doing or exposing their sun, where, I wear sunscreen, but I'm not wearing the right one, or maybe I'm not doing some of the right things.
Yeah. So, yes, there is prevention. And then a lot of what I'm doing is reactionary, right? People have not been using sunscreen, or they grew up in the era where baby oil and iodine was really in vogue and everybody was, holding those foil, sun reflectors up to their face, right?
Yeah.
And sunscreen just really wasn't widely available. The formulas were really unpleasing to use. And so a lot of that has been reactionary. But there is so much more knowledge and so much more preventative measures for so many things, skin as well as just general health, that a lot of my job too is just educating people on what they need to do. When it comes to sunscreen, that's probably the most common question I get asked is, like, what's the best sunscreen?
That
What is a
was my
sunscreen?
next question.
Yeah,
for you.
what is the
Exactly.
sunscreen I
You
should
read
be
my
using?
mind.
And in reality, sunscreen, anything that has an SPF on the label is really heavily regulated by the FDA. And so if something says that it is an SPF of 30, for example, if you have two different brands, they're going to perform equally as well at reflecting or, changing the sun's rays into not being harmful. Sure. And so anything that has an SPF on it is going to be equally as effective. Now, some may be a little bit more water resistant. Some, the formulas might be different. But if you've got two SPF 30 sunscreens, they're both going to work equally well. And so there is no one best sunscreen. It's really just a sunscreen that you like using. If you use it, if you apply it, if, your partner doesn't have to chase you around, like trying to get you to rub sunscreen on, then it's going to be an effective one. So I tell patients to look for an SPF of 50 or higher and to try and reapply like every 2 hours if you're going to be outside. Reapply more frequently if you're going to be sweating or like swimming in the water.
Sure.
But I actually really like sun protective clothing because nobody likes putting sunscreen on. Like I don't know a single person who likes it. Everybody's fighting with their kids to get sunscreen on them.
Sound like me, for
exactly.
sure. Yep.
Like nobody likes it. And so if you're going to be outside, especially for long periods of time, wearing sun protective clothing, sun protective sleeves, things like that is going to be even more effective because you don't have to worry about user error of getting enough on, getting it in all of the right places. And then you just don't have to reapply it. You don't have to feel greasy afterwards.
That's
so
true.
I like sun protective clothing a lot.
Yep.
And how quickly, if I'm in there without sunscreen or like even in Vegas, like a normal day, I feel like 9 out of 10 people are not
Nobody wears
walk
sunscreen.
outside to put
Yeah.
sunscreen on a normal day. And me, I have a bald head, so I'm constantly getting some sort of exposure, right? Maybe I don't have sunscreen on. Like, how is that something like every day, like you should be doing it, not necessarily when you're spending a lot of time outside? If I'm outside for 30 minutes, is that a time where I should have had sunscreen on?
You should wear sunscreen every single day, rain or shine, summer or winter, it doesn't matter because you're getting ultraviolet radiation through windows. You're getting it reflected off of surfaces like glass, water. Even if you're skiing, it's being reflected off of snow. So all of those things, change the path of that ultraviolet radiation. So you really have to wear it every single day. If you're in your car, you're getting sun exposure. If you're walking out to get your mail, you're getting sun exposure. And that cumulative sun exposure does really add up when it comes to damaging your skin.
Okay, I did not
yeah,
know
so
that
that's
at all,
first for
man.
me.
That
That's
one
eye
just
opener.
caught me off guard. That's great information. So, like, for example, like, it's a sauna here, right? When it's 115, 116 degrees in the summertime, like my kids play soccer and stuff like that. And then my wife is always yelling at me, like, when you go past like 10 a.m. in the morning, right? So is there times in Vegas that's like, don't go outside, you know what I mean, as far as that, or get your workout in maybe earlier in the morning because you're so exposed, you know what I mean?
Absolutely.
And the sunscreen's probably not blocking anything, you know what I mean, at
Absolutely.
115.
Between 10 and 4 10 and 2 is really the peak time, but between 9 and 4 is a time where I say, definitely have a thick layer of sunscreen on or sun protective clothing. And if you can, just try to avoid the sun. But not everybody can avoid the sun. People have to be walking their kids to school. People work outside here. You're standing at the soccer game, you know. So you have to live your life. And that's why I really like sun protective clothing. But in general, dermatologists recommend avoiding being outside during peak hours if you can, but not everybody can.
Yep.
And is there times where, like, as an example, like when I used to live in Michigan, and when I was in Michigan, I used to get sunburns all the time. I've been in Vegas now 10, 12 years. I don't think I've ever gotten a sunburn. And does that mean that it's less harmful for me being in an area like Vegas than an alternative location where I am getting sunburn? Like a sunburn, is there a threshold for when that exposure becomes too much?
So a sunburn is definitely damaging to your skin, and having frequent sunburns or intense blistering sunburns is a huge risk factor to developing skin cancer. But so is just having cumulative sun exposure. In general, both are bad for you. Anytime you're getting a tan or you're getting a burn, it's your body's response to having too much radiation. So a burn is like a radiation response to the sun's rays.
Oh, very
so
interesting.
I'm from Wisconsin, so
we're all from the
next
Midwest
door
at this table.
neighbors.
Yeah.
And I, grew up having tons of sunburns because I hated wearing sunscreen. And I think being in a really warm climate too, you're just more prompt. Like it prompts you more to put sunscreen on because you're in the heat. It makes you think that you have more sun exposure. And so it's pretty frequent for people in colder climates not to remember to wear sunscreen because it doesn't feel like you should be putting it on. You feel like you should be wearing it if you're at a beach or in warm weather.
Yeah.
That brings me to my next question about being at the beach, right? Like I'm always getting cursed out by my wife. Like when you're going, like let's say for example, we just went to Tulum and we went to Bahamas and stuff like that. So like the goal is to get a suntan during the week, right? But that's probably horrible for you, right?
Yeah, not good.
Okay.
Yeah.
Okay.
Yeah, so really there's no situation where you recommend getting a suntan because essentially that means you're doing damage. Like
I mean, it's really good job security for me. So
good point. Very good point. Yeah. Very good point.
But no, anytime you have a suntan, that's your body's response to having had too much sun exposure.
Yeah.
So there's no such thing as a safe tan. Burns are not good for you. Getting a base tan before you go on vacation isn't good for you. So really just trying to avoid the sun.
Yeah.
As much as possible. I mean, you don't need to be a vampire,
Eye
right?
opening for me. Yeah.
I've
This is
never
why I
had
want to
tan
sit
in my
down
whole
with you.
life, so I think I'm good.
Well, it's crazy too, like especially for black people, right? We've never wore suntan lotion. Do you have to treat a lot of black folks, you know what I mean, as far as skin cancer and things like that? Is that some of your customers that you see on a regular basis?
It is not very common to treat black people with skin cancer. I've treated a lot of Hispanic people with skin cancer.
Just because of the lighter,
Yeah, but sunscreen may not help you prevent skin cancer. There isn't great data showing that in people of color, people who are black, that wearing sunscreen really prevents skin cancer.
Sure.
But it does prevent signs of aging. It prevents hyperpigmentation. Your skin is really good at developing pigment. And so if you have any sort of rash or inflammatory skin condition or even like a bug bite, it can leave a footprint of pigment behind later. And sunscreen will help prevent that hyperpigmentation from forming. So it's not like it isn't good to use.
Sure.
It may not change your risk of developing skin cancer.
Got it.
But it will help prevent aging, wrinkles, those kinds of things too.
That's amazing. Yeah.
And outside of kind of sun exposure, I know we spent a lot of time on that because it's very fascinating.
No,
for
so
us.
yeah,
I
this
did
is
not
good
know
to
a lot
stay in
about
that rabbit
stuff.
hole.
Well, we're in the desert.
Yeah.
But what are kind of some of the other things that you see people doing that really impact? Is it some makeups that are being utilized, or some lotions that are being incorrectly applied, or even like a tanner to that sense that we're putting on to prevent going out the sun to get a tan? So I'm applying a tanner that's now negatively affecting me.
Yeah.
So you're asking, like, are there other things that are
like what's one of the bigger items that also you see as a contributing factor to kind of some of these skin cancers versus just being a sun-related issue?
So, I mean, the vast majority is sun-related, but immunosuppression, so having a weakened immune system, is also related to cancer development. So somebody who has had a kidney transplant, for instance, you have to be on medications that suppress your immune system in order for your body to not reject that grafted organ from the donor. So if you don't have your immune system is constantly surveying your cells to make sure that they are working properly. And if your cells are not working properly, your immune system targets to destroy them. And so if you have a cancerous cell, your immune system recognizes markers on the surface of that cell and targets that cell for destruction. But if you're on immunosuppressive medications, your immune system can't do that. And so some of my most frequent flyers are patients who have had kidney transplants, heart transplants, liver transplants, but mainly kidney transplants just because of how frequently those are done.
Got it.
So immunosuppression is also a risk factor for developing skin cancers.
Oh, geez.
That's power. Yeah, that's wild. Managing a client's expectation, I know, is one of the biggest challenges. How do you overcome that? Is it meeting with them multiple times before, making them feel comfortable before you're sitting down with them and doing a surgery on them, or how do you make that work?
So I'll see patients in consultation just so that they get used to me. We can talk about the procedure, what to expect. I think a lot of patient anxiety is just related to not knowing how the day is going to go, and
of course, yep.
How big is this cancer going to be? How is my scar going to look? What are my stitches going to look like? Things like that. So trying to meet them first to just get expectations on the table and make sure that they know exactly how the day is going to go as best that you can gauge it.
Sure.
Is really important. And then just throughout the day, making sure that they're comfortable. I see patients pretty frequently in follow-up, just, holding their hand through the recovery, because if I'm operating near the eye or actually on the eyelid, they can look really swollen, like really bad for a couple of weeks afterwards. And so just letting patients know, this is normal. This is exactly how you should look. You should look like I punched you in the eye. That's all really normal after surgery. So I like to see them pretty frequently in follow-up just to make sure that they're, that they know that they're on the right track. This is kind of a controversial thing, but I actually give my cell phone number to every single patient that I operate on. And I've operated on thousands of patients. I've done almost 6,000 cancer surgeries, and I have never had a patient abuse that. So sometimes just knowing that they can get a hold of me if they need to is enough to just kind of temper some anxiety about the whole procedure.
Yeah.
I'm sure that will come someday to
bite you a little bit. Yeah, for sure.
But, for now, I sleep better at night knowing that patients can get a hold of me if they need to. They can call me if they're having any sort of issue, any sort of problem. And I think that alleviates a lot of anxiety and a lot of fear that they have.
That's awesome.
How do you, so I'm 36, I've never been to a dermatologist. And, and this is something, like you said, some of the job is reactionary versus preventative, and your job really is trying to develop those relationships after kind of an issue has kind of presented itself. Is it recommended to start building a relationship with a dermatologist so in the event that something does happen, you're more readily available and aware of it?
So it's not too late.
Yeah.
It really depends on your risk factors. So if you have a family member who has had a skin cancer, if you do have some sort of immunosuppression, if you have more than 50 moles on your body, if you have some of these risk factors for having had, an increased risk for developing skin cancer, if you've had a lot of burns, which it sounds like you have had, Chris, it wouldn't be the worst idea to establish care with a dermatologist. You don't necessarily need to go every year for the rest of your life. But if you do get checked periodically, or if you do have those risk factors for developing a skin cancer, then it's a great idea to get an exam. They're quick. They're like 10 minutes. They're non-invasive. It's a scan of your body just to make sure that everything is looking normal and healthy.
Interesting, yeah.
That's awesome. That's a good question. Making me nervous, man. Yeah, you answer the question, I'm like, damn, I got scheduled to go see a dermatologist.
Definitely,
yeah. With us being Vegas Circle, we always reflecting on importance of people, and being in your circle and impacting you. What's kind of the biggest lesson and guidance that you kind of learn from somebody, whether it's personal or business?
One of the things that I learned early on, and I think this is true in medicine, but it's probably true in multiple different fields. But whenever you're having a one-on-one relationship with a patient, a client, whatever, trying to find something that you have in common with that person, sharing some sort of common ground, I think will help both of you reach your goals faster, easier, and with probably a little bit less friction. And so usually, if a patient's anxious coming in and we can find something to talk about. I like to golf. That's very common here in Vegas. So we can usually talk about golf. If you can get somebody's mind off of an anxiety-producing situation, if you can find some common ground, you tend to see the humanity in each other a little bit more. And I don't think there's ever been an angry or unruly patient that I haven't been able to find some sort of commonality or shared interest. And then I think we both recognize the humanity in one another and can find a mutual kind of way forward to make sure that their goals are being met, my goals are being met, and we have a clear path forward. So I guess just finding something in common with everybody, it's not hard. It's like you can do it. And then that can make any situation into a better one.
That's awesome.
They're kind of like, you establish your practice, right? You have experience, you have, a lot of background of, being successful in these endeavors, but how do you grow a practice in that way? Because obviously it's only you kind of navigating that. And, at what point is it like, do you ever hit a threshold of how many clients you can see? Or is it consistently you have to get your name out there showing that you're experienced? And because it is a business, right? Also on top of being a service-related industry, you're still trying to grow that and, have a business model responsive to that.
So I'm one of several doctors in a practice. It's not my own practice. I'm one of the physicians there. So right off the bat, that's great. We have a marketing team,
awesome.
we have people that try and help get the name out into the community. But then, sometimes you just have to meet people and,
word
again,
of mouth and
word of
network,
mouth,
referrals and stuff.
Yeah, I do. I mean, I think social media podcasts, all those kind of things are really helpful. I have a professional social media account that I use that I try to show before and after photos, do some education with. And I reach a lot of patients that way too. I get a lot of patients coming in for cosmetic procedures because of what they've seen online. So I think any way that you can, if you love what you do, you never mind talking about it, obviously. And so, just word of mouth that way. And I try never to really promote myself. Hopefully if you are getting the word out and I don't know, you don't really need to.
Yeah, it's kind of hard. It's kind of hard to recruit for that, right?
Yeah.
Like, hey, come see me. It feels a little hard to do, but I'd rather give a good experience.
Exactly. Yeah.
I actually love your approach because you're very funny, by the way. Like you got a very organic way of doing it where it makes people feel more comfortable. We're like, wow, I want to go see her and see what she has to do, which is good. Yeah, that's awesome. I love food. We talked about this on the phone a little bit, so we always ask our guests about favorite restaurants in Vegas. What's your favorite restaurant in Vegas?
I don't have one.
Okay. Yeah.
I'll give you the categories because I have a lot of friends who come in and visit and they'll say, okay, Brittany, where do I need to go to eat? Where do I need to go? Yeah. And again, this is very subjective because food is very subjective. But when it comes to, if you want a strip experience, my two favorite restaurants are the Nomad Library. If you want to talk, if you want to hear each other, you don't want to hear loud decibel might damage your hearing type of music during dinner, I would say go to Nomad Library.
I love Nomad. It's an excellent restaurant.
Love it. Yeah. I also really like Mother Wolf. It's new. It's at the Fountain Blue.
Oh, yeah, that's very good.
Okay. You went to Mother Wolf, huh?
Yeah.
Some of the best, food I've had in a long time. Very, very good. Excellent service. And good also, stuff. I don't like super loud restaurants. I want to talk. I want to have a conversation. So those are my two on the strip that are not crazy loud. Yeah. My two favorite kind of just off strip restaurants would be Sparrow and Wolf. And yes. And Partage. It's a prefix French restaurant.
Yes.
It doesn't really have a menu. It's just what the chef wants to make. And that's fantastic. Very, very good.
Those are two we got to check out.
Yeah.
Partage and Sparrow and Wolf.
Sparrow and Wolf is great.
Oh my
you
gosh,
went to Sparrow and Wolf.
Finally go to some places that I've been to.
There we go. There we go.
Time.
Shout out. I love your palate. So that's great.
Yeah.
So the 4 restaurants you brought out are excellent. I'm gonna check those out, man. Shout out to those restaurants. What else did we forget that we that you want to leave us out on, or a question that you want us to ask you?
I think we covered things pretty comprehensively. I would say questions that I commonly get asked are, what's the best sunscreen? We covered that.
Yes.
Another question I get asked pretty frequently are, if you could just pick 2 or 3 products that pretty much everybody should use, what would they be? Sunscreen, obviously.
Yes.
Okay. Yep. We've I think exhausted that one. But I think a vitamin C or antioxidant serum would be really great. That helps deal with sun damage if you've had it, kind of take care of some of the free radicals that you can get from ultraviolet radiation. And then a retinoid. Prescription strength is going to be best, but over-the-counter works great too. Less irritation, better tolerability if you're using an over-the-counter strength. So that's a very common question I get asked too, or what 3 things should everybody have in their skincare routine?
Sure, yeah.
But otherwise, I think you.
Awesome.
What is a retinoid? Just for my own.
So it is a vitamin A. So tretinoin is the most common prescription strength retinoid. And it is a ingredient that helps speed turnover of the skin. It can actually prevent skin cancers from developing if you use it with regular use. It reduces fine lines and wrinkles. It reduces pigmentation. It is kind of the fountain of youth in a tube.
I have never heard of it before, so that is awesome.
Is it like a face cream or something, a whole body cream?
It's a face cream, although a lot of over-the-counter products are now coming out with body versions of it too. The concentrations have to be lower because you can get absorption through your skin. So the concentrations for body products are going to be lower strength than for face products.
Awesome.
But yeah, very good thing for just about everybody to use unless you have very sensitive rosacea-prone skin.
This was very good.
Yeah, it was very good.
I learned a lot from sitting down with you. This is excellent, especially the wearing sunscreen every day. I never thought to do that.
Yeah, because the sun doesn't go away. So you think about it, just your time in it.
Yeah, exactly.
This is good stuff, man. Brittany, where can people reach out? What is your social handles and things like that? Yep.
My social handle is Britt the Skin MD. I'm mainly on Instagram, a little bit on TikTok, and then you can find me at Vivida Dermatology in Henderson.
Awesome. Well, absolute pleasure to sit down with you. Check us out at thegoodscircle.com and appreciate you. Appreciate your time.
Thank you for
Thank you so
having
much.
me.
That was
Lovely
amazing.
to be here.
Yeah,
That was great.
awesome.
I definitely need to go buy some stuff.